Well, sometimes when breast cancer is not detected early enough, patients need to turn to surgery for treatment. That's the topic of this morning's interview with IU Health Arnett physician Dr. Serene Sharif. Thank you so much, Dr. Sharif, for joining us this morning. So let's talk. There's many different opportunities you could go forward with when it comes to surgery. Tell us a little bit about a few of those options.
Sure. So surgery has been an evolving field significantly since the role of medical oncology and radiation oncology has advanced. We're able to do more with less now. And one of the things that we can do now is with breast cancer, we can just remove the area of the cancer, preserve the remaining part of the breast, and this is most commonly known as a partial mastectomy or a lumpectomy. And this allows for the women to keep their natural breast shape and just remove the area of the breast cancer, and then they'll receive radiation therapy. In some women, unfortunately, the breast cancer has advanced to a stage that we are unable to do that, and they may need a mastectomy. And it's good to know that we don't have to remove the entire breast and all of the skin tissue, and they don't really have many options after that. We're able to do skin-sparing mastectomy and even nipple-sparing mastectomy to preserve the natural shape and contour, and then they can have reconstructive surgery. So this is essentially removing all of the breast tissue, and in the case of a nipple-sparing mastectomy, even preserving the nipple and areola complex.
And at what point, I know that it's probably case by case, but at what point does a woman need surgery?
Well, breast cancer, management of breast cancer always involves surgery. It's a multidisciplinary management, and it includes surgery, possibly radiation therapy, and possibly chemotherapy or other hormonal therapy. It depends on the patient's tumor pathology and their family history and their other medical conditions and needs, but the management of breast cancer always involves surgery and removing the area of cancer.
Certainly, and you said, this is something that's constantly changing.
It is, and our goals are to remove the cancer cells as well as to give them a good cosmetic outcome, because we don't want, we want to be able for the women to look in the mirror and not constantly face their battle scars of breast cancer, but instead to feel normal again.
Certainly. Dr. Serene Sharif, thank you so much for joining us this morning. We certainly appreciate it.